this computer. Yeah, that'd be good. Okay. Well, thanks to all the people who are tuning in to Hearing Health and Technology Matters today. And my name is Bob Traynor, and I am a editor at HHTM. I have a special guest this afternoon, Dr. David Fabry. Dr. Fabry is the Chief Innovation Officer at Starkey Technologies Incorporated in Minneapolis. Dr. Fabry, in addition to numerous prestigious clinical positions within the profession and industry as well, is a past president of the American Academy of Audiology. He's also editor-in-chief of Audiology Today and a past editor of the Journal of the American Academy of Audiology. In addition to being a past editor of the prestigious Ear and Hearing Journal. I also learned that Dave is not just an executive, but also a licensed audiologist in Minnesota, as well as Florida. And probably a topic for another day, another time, is also in Rwanda. So we'll have to take that on another day sometime, Dave. But thanks very much for being with us this afternoon. I'm looking very much forward to our discussion, which is going to frame around the idea of how we're going to integrate balance issues with hearing loss and falling and some of these other things. So, so my first question for you this afternoon is, what's the connection between falls and hearing loss? A lot of us have done ENGs and balance assessments and so on over the years, but for me, it's been quite a long time, and I suspect it's been quite a long time for many of my colleagues, but integrating these is rather unique. So fill us in as to how this is going down.
Sure. Well, thanks, Bob, for having me here today to talk about this during Fall Prevention Week, and I think it is timely. And this certainly has been a mission that we at Starkey have been on for the past several years, from the standpoint of when in August of 2018, when we launched then Livio AI, the industry's first device that incorporated embedded sensors in combination with machine learning and artificial intelligence. It was specifically to get at this issue that you alluded to of the, we all know, and for those of us who are in the profession, the importance of hearing is often taken for granted until it's lost. And I think the COVID-19 pandemic has reminded many of us, and then as well, perhaps for the first time, sort of brought to attention of a lot of people that if they had mild hearing loss during this 24/7 news cycle, how important it was. But then, as you alluded to, the comorbidities between hearing loss and other important health conditions have been increasing in prominence in, I would say really the last decade or two. I think back to the first study that I remember where linking hearing loss among the larger healthcare discipline was to diabetes back in around 2004, where they used the NHANES database to show that people with diabetes also were at, with hearing loss were at increased risk for diabetes, vice versa, diabetes were at increased risk for hearing loss. And what we've seen over the ensuing years as we started to bring hearing more into the healthcare environment is the comorbidities to cardiovascular disease and cognitive decline have been well focused. But falls are something that when you think about the audio and balance system are tied together, we often take that for granted. And in many conditions, chronic or acute conditions, there is both a hearing and balance component. Think of Meniere's syndrome that may have more of a balance component or a hearing component or the combination. And when we were first bringing Livio AI to market, it was really in this effort to focus on the fact that even according to research that was published at Johns Hopkins, that even with a mild degree of hearing loss, people are roughly 3 times at elevated risk for falls than the general population. And that they went on that every 10 dB of hearing loss above that increases the risk, certainly for those with untreated hearing loss. And there are a wide variety of reasons for that. Number one is perhaps damage to the peripheral hearing and balance system, given that they are connected, as you know. But then also just the issue of sort of cognitive load, that when you have a hearing loss and you are having difficulty with hearing, that when you factor into all of the things that relate to your balance, including, as you mentioned, proprioception, input that you're getting from your eyes, your ears, your feet, your posture, all of that takes some effort and coordination. As like always, we talk about really the periphery picks up the motion or the sense of hearing, and then the brain sorts out the rest. And with balance, it is such a complex system that involves input from multiple sources. And when there is any sort of abnormality, it can be life-threatening. And we know from the statistics that there is a huge economic and emotional cost to falls, to society when falls occur. And in aging individuals, unfortunately, when they suffer a fall, it often is a sentinel event for a downward spiral in their overall health condition, particularly if they happen to break their hip or break their arm. But their hip is sort of the worst case scenario, because it often begins a downward spiral. And while people don't always or often die directly as a consequence of a fall in the home, they may suffer a broken bone or other conditions that lead to an eventual downward spiral in their overall health condition. So it's really, hearing and balance are inextricably intertwined. If you have a mild hearing loss and you're not doing anything about it in the form of amplification, we know that you're at elevated risk for falls. And even before people suffer that first fall, they're at risk for that condition. And the older we get, the more that risk takes place with regards to the consequences of a fall.
In some of my geriatric audiology days, which has been a few years ago when I was doing lots of work in that area, but at that time, and these are data that go back into the 70s, that 84% of the time someone falls, that's their entrance into the nursing home, where they will have to have continuous attention over a long period of time.
Now you say, I used to study and really focus on geriatric audiology, and now I've become a geriatric audiologist.
Yeah, me too.
For a matter of semantics.
That's for sure. Well, how does Starkey detection technology actually work to facilitate less falls and so on?
Yeah, one of the cool things that I've had the privilege and opportunity to work on is, as we developed this first product, and this works for both standard and custom devices now. We launched a custom rechargeable 2.4 gigahertz product, as well as a BTE device, in addition to the most popular style that is in current use, RICs. And with the device, there are embedded IMUs, inertial motion detectors or units, in the device that are capable of monitoring things that people who wear wrist-worn devices probably are well familiar with. You can monitor your step count on a daily basis. You can monitor whether you're exercising, whether you're even getting up and moving around every hour to sort of keep musculoskeletal strength at its peak. And so what we also found quickly was that when we introduced that IMU capable of measuring acceleration and motion, that in the same way, we can monitor whether a person suffers a fall. And looking at the ways that people typically fall, they will either slip or trip forward or backwards, or sway to the side. And when you consider you have the IMU in the left device, and consider that most people are now fitted binaurally in both ears, you have the benefit of having two devices that can coordinate with each other and that can provide valuable information about whether or not the person is moving, taking steps, whether they're swaying, whether they make contact, if they go through a fall where they suffer an acceleration and make contact and then hold still for a little bit, there are various events, if you will, that trigger a fall on the output of the IMU. And then the beauty is that we have two devices that, in most cases, it works in the case of a monaural fitting, but the benefit of binaural is that if one device falls and the other one is still maintaining its position on the head, it knows that that's likely not a false positive. Whereas if you only have one device and you have that motion and contact, you don't have that ability to sort of work on the sensitivity and specificity. But so using IMUs that we began to do as we began this pathway to using embedded sensors directly in the hearing instrument, not only for recording physical activity and social engagement, if you will, that's a different topic, but then what it enabled people to do is using the application that controls the hearing aids to allow them to change the volume control and change the program, also allows them to set up fall alerts that can, with permission of the hearing aid user and agreement on the part of up to 3 contacts in terms of trusted sources. There's a handshake agreement that ensures HIPAA compliance and that they're communicating with each other, that if I suffer a fall when I'm wearing my devices, it will give a 60-second countdown to allow me to either recover and say, well, I didn't fall or I fell, but I'm okay. Or I can also override that 60-second countdown and it will send a text alert to a trusted contact who that up to 3 of them. When one or any one of them receives that alert via text and they enter their identifying information to disclose that they are who the text is intended for, then it will alert the person who fell that one of their contacts received the alert and responded to it. And then as well for the person on the other end, they not only know that the person had a fall, but using the location services on the phone, it will actually show on a map where their loved one or their family member were when they fell. So if for some reason you can't pick up the phone and call them or reach them via text, you can see where they are no matter around the world where you are. I can tell you because I've awakened my wife, Liz, when I've been on the other side of the world back in the day when I used to travel, practicing for a presentation or demonstrating it to someone, and awakened her in the middle of the night if I happen to be in Asia. But this feature, number one, it gives confidence to family members or caregivers of those who want to live independently in their homes and also want peace of mind to know that their loved ones are safe if they are at risk for falls, if they are living independently and there isn't someone that can monitor them constantly, but be alerted in the event that they unfortunately suffer a fall. And that was really our first effort in sort of providing a fall detection algorithm that we think, and we have our customers and telling us about their patients who are saying that this is a life-changing benefit for either the hearing aid user or the family member to lessen their anxiety about mom or dad living in home, living independently, but wanting to remain there rather than going into an assisted center.
Absolutely. And it also is much better looking than the string with the big button.
Yeah, well, in the old days, and you and I both, are close enough to the same age that we remember that I've fallen and I can't get up.
Yeah, we do.
And not wanting to have that thing around the neck. Well, all in this case, you got the benefit of having double the sensors, and it's not worn around the neck, and that created some. I think that's every baby boomer's nightmare. I didn't want to be that older woman laying on the floor without anyone to respond to. But interesting you say that, because we do have a publication in JAAA. I'm not one of the authors, but our team has a publication from December of last year that looked at and compared the sensitivity and specificity of our fall detection algorithm to a popular neck-worn device, and found that the sensitivity and specificity, I'll let people look for themselves, but the sensitivity and specificity was comparable or better to those neck-worn devices. And really all the hearing aid user has to do is wear their devices in order to receive that benefit.
How cool is that? Because most of the patients that have a lot of those issues also have hearing loss, and they may have some other comorbidities as well. But that cuts some of the overall costs and monthly costs and some of those things that older people often have to put up with. So, well, do you have some specific tips for fall prevention now that we're in a fall prevention mode?
Well, it's a great point, and there are lots of people that are far more qualified than I from a clinical standpoint, whether they're audiologists or whether they're physical therapists, to discuss this topic. But a few things are, if you're living with someone who is at risk for falls, try to not be rearranging the furniture all of the time. It seems like a real minor point, but I, as somebody who has a visual impairment as well, is in the dark. You know, a lot of these falls occur in the evening. They're getting up to go to the restroom or getting up in the night, and where vision is low lighting is difficult for aging individuals anyway. And so rearranging things just haphazardly is a challenge for individuals, and try to keep that. And really, there are teams that can come in and establish where the clutter is, where the risk is for individuals in the home environment. And then I think as well, another area that we're really working on is, and I've talked with a number of balance experts who suggest that something as simple as getting up and moving around and walking. I mean, we're built to walk. The human, I think, more than running, and I know you're a runner, and I was a runner before my knees gave out, and boy, you miss them when they're gone. But, you know, we're built to walk, and musculoskeletal strength and that proprioception and that ability to just go out and do 10,000 steps a day is something that, you know, I will put out there as a good a habit to get into for a variety of reasons: cardiovascular disease, obesity, musculoskeletal strength. And it's one of the other reasons why within the Thrive app, the control app that controls that fall detection, also enables me to gamify each and every day how many steps that I get. And I'll show you, I'm not cheating. Today, I've got my almost 10,000 steps. They say the journey of 10,000 steps begins with one. And each day I try to simply to get up and walk and 10,000 steps throughout the course of the day. Even in the COVID-19 pandemic, it's possible. You end up walking, being more creative with that. But trying to do that, if you want to maintain good musculoskeletal strength, is the bare minimum, I think. And we know that the benefits of 10,000 steps a day is important. The other thing within that context that we're working on is really trying to use the IMUs in the devices and think about balance training exercises. And these don't have to be gymnastics or anything significant, but there are a number of established
Popcorn, Cooksey kinds of things.
Exactly. Yeah. And we know even that simple act, in many cases, people that are at risk for falls have difficulty rising up out of a chair and then coming down into a chair without flopping into it. And so even just working on trying to slowly be seated in the chair, again, it's that musculoskeletal strength. It's taking into consideration all of those things that make us and increase the risk for falls. So balance training exercises, whether it's through an audiologist, through a physical therapist, or someone else, I think if you are concerned that you're seeing that you're wobbly, that you're feeling uncertain, and you know, Minnesota, Colorado are both challenging places in the winter in aging years because of the presence of ice. As we mentioned, there are a wide variety of ways that people fall, but very common in these cold weather states are slips and trips that often, even if you're trying to be very deliberate and careful in maintaining that walking and the core strength. You step on ice and sometimes you just go down. And so sometimes it's just unpredictable. But I think trying to minimize clutter, trying to work on ensuring that you have a safe home is important. And then I think something as simple for those who want to start simpler of just trying to go at that physical active target of 10,000 steps a day, getting up and moving around a little bit every hour. If you know that you're at risk because there are other conditions that complicate this, like cardiovascular ones where you're lightheaded when you rise, maybe work on rising out of a chair more slowly rather than getting up like you used to, so that you're not getting lightheaded and you're not at risk for falls. And I would consult with an audiologist who specializes in this area, ear, nose, and throat physician, physical therapy, and certainly if someone has a concern that they're at risk for falls because they have a hearing loss and they've noticed that their balance isn't as good as it used to be, maybe they can work on some of those balance exercises. And that's certainly a long-term goal for us, as well as that, the first goal was getting a good fall detection algorithm, but it's really one step on a journey that we have for, sort of alerting and being aware of those individuals who have fallen, are more likely to fall in the future. And we want to prevent those whenever possible. And then really work in combination with the overall system to keep that fall from ever happening before the break occurs. A broken hip, as you said, that is often a signal event for entering into assisted centers.
This really is a huge, for audiology colleagues, this is a huge practice differentiator where you can provide two things for your patient instead of a single issue. You can work with them on their falling, you can work with them on their hearing impairment, as well as I would hope that these kinds of things reach the attention of assisted living people, because that will also be another huge source for audiology practices to begin their differentiation as well. So I certainly want to thank you for your orientation to what's happening with falling and hearing loss and amplification. The place for Hearing Health and Technology Matters is to attempt to call attention to new technologies and new things that are coming out within the profession. And my guest this afternoon has been Dr. David Fabry, Chief Innovation Officer for Starkey Laboratories. Thank you so much for being with us this afternoon, Dave. And we'll look forward to hearing more and more about the product that will tell us all about what's happening with our falling disorders. Thanks again.
Thank you so much, Bob.